humidity.
All right. So we're here today with Nanci. Nanci's been a patient in our office for, it's been about 5 months now. And I've been meaning to get this sooner, we just haven't gotten around to it. Nanci came in, her major health concerns were she was diabetic, she was taking insulin and oral medication as well. She had high blood pressure, high cholesterol, high liver enzymes, and she just wasn't feeling as well as she could have been. So 5 months out, tell us a little bit about what your experience is and what's happened since then.
Well, I've started to change my diet and gotten off of gluten and dairy products and began to lose some weight. Not the amount that I wanted, but I'm working on it still. And gradually my blood sugar started dropping, and it dropped more and more, and to the point where I got totally off of insulin, which was a big accomplishment for me. I was taking 4 shots a day.
And you know what? That wasn't that long into treatment either.
No, it was
less. It was like a month.
Yeah, 4 or 5 weeks exactly.
Yeah. Okay, we're still taking the oral medicine, but the insulin you've been off of for quite some time.
Yes.
Okay, great. Go on.
The other thing was I've had issues with my liver for a number of years, where my liver enzymes have been very elevated, and cholesterol's been elevated, and high blood pressure, and my blood pressure's just dropped like 50-60 points. Is now down in a normal range, a good normal range. My liver enzymes dropped tremendously from way high to normal ranges, which I haven't seen ever.
Great.
And my, what was the other one? My blood pressure,
cholesterol, liver enzymes,
and the blood pressure's come down.
Right.
I'm off of blood pressure medicine.
Great.
So,
fantastic.
all of that's, yes, it's amazing. All of that's much better.
So you know, the interesting thing is with liver enzymes that are high, I see this relatively frequently where patients come in with liver enzymes that are high. They're not high enough that they would be pathologic, like hepatitis or something like that, but they're double, triple, quadruple what they should be, but under 100. And what I see without fail is those patients are normally undiagnosed celiac patients. So as you know, we checked you like we do all of our patients, and we had some of those issues that came up for you. So really, the driving force behind those high liver enzymes for you was the fact that you had a problem with wheat products.
Right.
And when we took them away from you and did some liver therapy with you, that cleaned up really nicely. I was surprised myself to see the numbers right themselves so quick. Right. What would you tell other folks who have a similar problem, diabetic, maybe prediabetes, syndrome X, high cholesterol? What would you tell them about what you've experienced here, and what would you recommend as far as what they would do?
Well, for me, I was tired of taking insulin, and I knew I needed to change the way I eat. I didn't know it was gluten, but I knew I needed to get off of eating so many sweets and sugars and carbs. And I just couldn't seem to get a handle on it, and that's what you really helped me with. And we really wouldn't have known. You knew it, but I wouldn't have known it without the testing. And so I would recommend anybody that wants to get off of insulin that there are other ways to go get yourself checked out, see if there's other issues going on, and explore those options.
Yes, I wanted to recap on some of the numbers with you too while I'm thinking about it. Nanci's A1C initially was 10.6.
Yes.
And we redid blood work at like I think it was
about 3 months.
A 3-month interval, and it went to 6.5.
6.5.
Which is right outside the lab range.
Right.
The lab range for diabetes is above 6.4. So technically, according to the lab, you still have diabetes because of the numbers. Also, your actual fasting blood glucose was where in the beginning? Your blood sugar when you took it?
The fasting blood sugar, it was still high. I don't remember exactly what it was.
On your initial blood work, it was 178, I think.
I knew it was
and
high.
Then it dropped to like a 135. So we still have some work to do, but I'm really pretty pleased with the results we've had thus far.
And I was very surprised to see this much difference in this short
period of time. You're right. Yeah. So we still have some work to do. We'll check back with you in a few months once we get a few more things done. All right?
All right.
Thank you, Nanci.
You're welcome.